I receive one appeal every day from a family member, a friend, a neighbor, a relative about their loved one's medical condition, and they want this story highlighted so that they can use the media platform to raise funds to meet in part or in full their medical bills. But we cannot always do that. So we ask ourselves this question: what can be done to make healthcare affordable as a country? What can be done so that we avoid out-of-pocket expenditure that has led so many people into poverty or into spending a lot of their finances on medical emergencies? And we start this episode from there. Access to basic healthcare is still a major challenge to many Kenyans, especially the poor and low-income earners. Very few Kenyans are members of a contributory medical scheme like the NHIF or a private medical insurer. As a result, in case of a medical emergency, many will resort to family, friends, and other well-wishers to fundraise in order to meet a medical bill and meet in part or in full the financial costs that come with a medical emergency. On this episode of Health Digest, we address that. The cost of healthcare, the medical bills that many of us face, the appeals that are out there, many people asking for people to fundraise so that they can meet the cost of healthcare, either in the country or out of this country. And we ask ourselves the question, why is healthcare so expensive?
How
old is he now?
2 years and 8 months. I'm a mother of 2. My firstborn is 5.5. I remember it was on 16th of March this year. He just had a running nose and some fever, and we thought it was just homa ya kawaida. So on taking him to hospital, the lab works were done and the results came out, and the doctor told me she highly suspects this is leukemia. We didn't take that, so we decided to go to another hospital now. And actually the test was redone. It was confirmed this is highly likely to be leukemia. At that point, I actually thought that was a death sentence for me, because all the stories I've been hearing about cancers, most of them have actually been ending up the other side. Yeah, very few have been successful, So to me, at that point, that was death sentence.
How long has he had this?
Osteomyelitis is now, this is the 3rd month. But sickle cell since 1 year old.
That's when you had it diagnosed?
Yeah.
My name is Camille Anan. I'm 10 years old and I'm in class 3.
He was born with sickle cell anemia. We've been managing it well. But on March 3rd, he got a very serious crisis. Sickle cell crisis normally affects the bones from the neck to the toes. So he got a very bad infection, that is the crisis.
My wife, Sophie, was expectant, right? And then she developed what is called, from the medical term, preeclampsia and hyperthyroidism disease in pregnancy. Now, she was taken ill the last month of a clinic visit. Then the day she went to the clinic, she was told now they cannot allow her to go home because they feel the pressures are too high. So she was admitted for 2 days in St. Francis, Kasarani. Then on the 2nd day, the pressures were still not down. So the doctors there felt they were not in a position to handle it at that point. So I was called. I was not actually in town. I was called that now they needed to transfer her to Kenyatta. At the time, I think Kenyatta staff were on strike or something. So they asked me, which other alternative do you have? So I told them to take her to Mata. Now, during her transition from St. Francis to Mata, her condition became worse. In the sense that she was not able to breathe on her own. She was taken to ICU, and I think her specialist, an endocrinologist or a cardiologist, who actually gave instructions that they should manage her pressure, because the cardiologist was not in the hospital then, manage her pressure. Once it's down, she should go for an emergency CS, which they did successfully. On the same day, she was transferred to Mata.
From the time the diagnosis was made, after the bone marrow was taken here for confirmation of the diagnosis, his doctor confirmed to us that we need to have a bone marrow transplant. And we were given options for hospitals in the USA, South Africa, India. And we settled for a hospital in India, of course with consultation from friends and other people who have been there. And the projections were going to up to between 4.5 and 6.5 million. So, they're telling you if this has to be done, they're giving us a projection because they cannot be definite, particular on how much it would be. So it's between 4.5 and 6.5 million Kenya shillings.
When they did the MRI, they discovered he had a fluid pus formed in his hip, that's the femur. So they had to take him for surgery. He's undergone 4 surgeries for this period. It's been so expensive for the family. Through friends, we had to seek an alternative opinion, and he's been referred to Israel. The doctors in Israel are ready and are willing to perform 2 surgeries on him. That is, one is to correct his dead bones. From the MRI scan, it shows that all his dead bones for both legs are died. They have died. They die because when you are having sickle cell, the crisis, the oxygen level becomes less. And therefore the bones, due to lack of oxygen, the bones die. That's why you can see pus, it comes out throughout. See, he had these surgeries just to ensure that the pus keeps on as an outlet. So it drips throughout. And it has really been expensive on us.
On the second day, I went to the hospital. She was active, very responsive. She was even talking. Then I asked her how the situation was, because I was away for 2 weeks. She told me she was brought, and these are what the doctors are saying, that we got a baby girl and she's not seen her. She's in the nursery, because the scan showed the baby was 33 weeks old. So she had to be taken to the nursery. So I was actually given direction to go see the baby and everything. Just 5 meters away from the ICU, I was called back that she's passed out. I went back there, and the doctors were all over her. They were resuscitating her. That happened for like close to a minute. Then the medical report that we got after that incident was that there was no enough oxygen to the brain, and that had even killed some of the brain cells. So her brain was damaged, according to that particular point, was damaged to between 70 and 75%. There were even, what do I call it? There were even moments when doctors felt, because of the damage on the brain, she could be paralyzed downwards. And for 22 days, she was just in a coma. She was not able to breathe on her own. She was on the ventilators and all those support machines.
Somehow, we started working through the treatment options that the baby would have, and ways and means of raising funds to have it treated. The treatment way in our hospitals here, you are treated and then you're given a bill after treatment has been done. So they will charge everything plus things that were not used, or they will charge because it has to be paid up. I won't deny it is very expensive. So our insurance came in. The first bill we were paid for by our insurance. It was about 600,000 thereabout, and we were in hospital for only 2 weeks, the first admission. The second time we went to hospital now, we had to pay out of pocket. And the reason why I went back was because after the baby had gotten his chemo, the side effects are terrible. You know, the nausea, the vomiting, the loss of weight, the loss of appetite, the diarrhea, everything was so bad. So we can't stay in the house with a sick child.
I don't sleep well.
Because of the pain?
Yeah.
We are appealing also for the well-wishers to help us raise the required amount, which is 8 million, to ensure that Camille returns back his normal bones. That's the first surgery for the bones. Then he'll have to go through what we call bone marrow transplant. The bone marrow transplant is where they kill all his bone marrows, then is donated new bone marrows. We are being accompanied by the sister, who is 14 years. She's going to be the donor, that he can get proper red blood cells that are not sickle, for him to be able to live his full life.
The cost is overwhelming, to say the least, because now the ICU bed, I think, goes for, I think it's over 10,000 a night. Yes. And now, because they were also trying to manage the thyroids and the pressures, she was on very powerful medication. And that, to some extent, using my own analysis, even affected the body system. Because then when the drugs that they were using on her to calm down the thyroids failed, now the other option that we had was now to import a radioiodine catalyst. It's a catalyst or supplement. Yes. So that they can completely kill the thyroid glands to stop generating the hormones. So this could not happen for a while again, because her body system completely failed. She was not able to support herself. And since these are radioactive substance, they felt if it is administered at that particular time, it will even affect her further.
No one will explain to you anything. You see, when you are getting discharged from hospital, like this was our first bill, this was 600. You know, you're just given the bill when you're getting discharged. So this is what you have to pay. It's upon you to go through and find out what has been done and what has not been done. The second bill was about 1.4 that we had to pay out of pocket. Of course, we had savings, you know. So we started eating into our savings.
Since March, we've expended around 1.8, what I can attest to, 1.8 in hospital.
Considering I was a student, actually I had taken an unpaid leave from my place of work to go back to school. And so with this kind of diagnosis, I have no salary because it was unpaid leave. So we all depend on my husband. So when you get this kind of diagnosis, you know, it's not just about the normal rent, bills, everything. It's about a condition now that we have to handle. So I was wondering, how will we even manage this diagnosis? And just knowing what the baby is suffering from Kwanzaa was a shock. And then the bills, because everyone tells you chemotherapy is expensive, radiotherapy is expensive, you know, appointments with doctors, all these things are going to be very expensive. So actually, I thought it is going to be a real problem.
It has been difficult for us. I'll tell you, we've spent not even about the cost. We spend sleepless nights. When he's in crisis, if you have had a sickle cell patient, you don't sleep. These girls have not been going to school. They miss school because they have been sleeping in hospital for the last 3 months. He's been crying. And that cry alone, I think it is time that God just has to cure him. I've not gone to work for the last 4 months.
Yeah, you're also on a work?
Yes. No, I closed up my office, brought everything in the house. I can only do 1, 2 things from the house. I can't run up and down with a sick person, a sick child.
I've managed to pay, because again, because of the baby, she was taken to the nursery and everything. The baby also attracted quite some substantial amount of money in her bill. When she was leaving the hospital, she had a bill of 300, which we cleared, and we managed to go home together. But then besides that, the mother's bill, because it's still growing, I've been paying. I've paid up to almost 700,000. Right now it stands at 5.3. Yes, and because she's still in the hospital and still not as responsive, though she's recorded quite a good improvement.
It reached a point we realized this is going to be very expensive. So now we decided to appeal to friends, family, yeah, Harambes, WhatsApp groups, pay bill finally. Yeah, so that is how we have managed to raise money. And NHIF also assisted, you know, paying partial bills like chemo, partial.
Initially, I had my savings, which I had now to take up, like in Aga Khan, when I was to pay 822,000, I had to take my savings. Part of it was, I have 4 children, he's the 4th born. I had to take school fees from the other siblings, whatever was their school fees, I had to take it and use it for medication. I had to, the second admission, I had to appeal to friends. I belong to a group of Moi University alumni. That's 2 or 3 class. They came in and gave me something. My former high school Gul girls, they also came in.
We have a pay bill. So I've contacted 2 Harambes that actually has given me this money, and from also my personal savings. Insurance, the insurance that we had took off immediately. Because now, from the medical report, they were saying that her condition is maternity rated, so they cannot pay anything beyond what is the maximum for the CS, which is 100,000. So that is the only amount they paid. I've contacted NHIF, but they've told me since the patient is still there, we cannot actually tell how much of this bill I would want the NHIF to take up for me.
NHIF will not pay everything for everything, no. It will pay for chemo and partial for bed when you're in hospital. But you know, there are so many other things. The doctor consultations, nursing care, antibiotics. And these kids are on antibiotics because you know that their immunity is gone. So antibiotics and nutritional supplements. My baby was so sick he could not feed. He needed nutritional supplements, those IV, you know, all those things, fluids, all those things we had to pay out of pocket.
And they give you this, and sometimes there's a lot of medical jargon. Do you get to know what this is, what this procedure was done, why it was done, and the cost of it?
Unless you actually ask. I would want to encourage mothers again to be quite aggressive, because you'll be given a bill that you will not even believe what has been going on. This other one was 150,000, you see, and this was a day's bill. So we decided to be collecting daily bills so that I can also understand what has been going on.
They give you a chance, what they call now scrutiny of the bill. If you feel there's anything that is not correct with the bill, you can take it, get anyone who understands this thing, scrutinize the bill, then you can now face them with those facts.
It's number. It's number.
It's?
Number.
It's numb. It goes numb. If it goes numb like this, it wants to start swelling. For sure, what I've gone through, I will say Kenya, we are very, very behind in terms of healthcare. Our healthcare is about management and not curative, especially with the chronic diseases. Also looking at it, sickle cell is not insured. They say it is a pre-existing condition. So even the insurance companies in Kenya cannot come in and help such a condition. It's very expensive. The doctor's fees are very expensive. There's no one who will attach your son or a sick person without getting deposit.
The cost of health in Kenya, I think it's just out of this world. And I think maybe, I don't know, something should be done about it. Because now we're even thinking of, could be, there are things that maybe you're paying for that were not even administered to the patient. Because the bill cannot be, at some point it was growing at 200,000 a day. It was that high. So, and with the type of healthcare that we have, I think it's just out of this world, to say the least.
So no one ever sits down to explain to you How do you even know if they double charged you?
It is upon you to find out. This was the one we paid. Yeah. You see now, it is upon you to go through your bills and as a mother, know what your child has been given. Like for me, they would come to give antibiotics. I would want to know, what is it you're giving my baby? It is this dawa. So I actually know offhand all the medicines that my baby has been getting. So upon discharge, when I go through my bills, I would actually know this has been done, this has not been done, this was given, and then it's upon me to now ask. With the rising of con men and women in our country, and maybe it's because everyone has problems, so everyone is looking for a way to get an extra coin. So even the Safaricom, someone will tell you, you know what, we're not promising that this will earn a lot because con men have come in, and all Kenyans, everyone has a problem. So mtu atawacha shida yake akusaidie, because how many people will you help? Everyone has a pay bill number for whatever it is. Everyone, whether ni harusi ama matanga, everyone has a pay bill number for everything. So they'll tell you, con men have come in and everyone is getting a pay bill these days. So they told us, do not expect it to be like it used to be uko kitambo sana. But we still went ahead and trusting God. Yeah.
The bill to me hasn't worried me of yet. Because so long as she gets well, I think the bill we can always pay through whichever means. Yes.
What do you mean through whichever means?
Whichever you can even go work for the hospital to pay the bill or whatever. But to me, the bill is not a very big issue so far, because now she's still in the hospital. Even if I ask for help today and someone comes up, I'm going to pay you 5 million, then it accumulates again to another 5 million. You see?
Of my two sons, Casey, the younger one, is that, as a mother, you always know how your kids are. The older one is soft, he's a gentleman, mpole kabisa. But this one is very playful, very outgoing and all that. So we always knew he would be that person who would go out and do anything he ever wanted to do. When he fell sick, I thought all those dreams were going into the trash. Because now he became, he lost weight from 14 kilos to 9 kilos. He lost appetite, all those things. So I was seeing it and wondering, what on this earth would he do? At some point, we lost hope. We were like, let's just do what we can do. But when he started picking up, after the 3rd session of chemo, he is picking up. And it is very involving also taking care of this child. Because now, I cannot go to work, I cannot go to school, I cannot do anything. I have to stay in the house and take care of the baby. Because any small infection really puts him down. So I have to stay and make sure I'm watching him myself. And so right now I've seen him improving a lot. And I'm still hoping and praying that all the things he wanted to do, he will still do.
Our healthcare is just management. He's gone to theater, like now he was referred to be in theater. For them to remove pus alone, I have to pay more than 200,000. Our healthcare, my appeal is that Kenya, our government should invest in health. If you can't afford, if you don't have money, if you are not the rich class, your health cannot be dealt with, especially chronic diseases. He's not been in school, and to the parents, we don't do anything but be in hospital. And this issue is just management, it's not curative. So my answer is to the affirmative. We waste a lot of time in hospital because of lack of proper technology, because of lack of proper attending in terms of the doctors. You can be in hospital and the doctor will come at midnight. You are in hospital from morning, they'll come and see him at midnight. And they say, tell you these are conditions that you know. So once you get there, they know what they're going to get. It's not only about money. Also, you'll know that you'll be in hospital not less than 20 days. So time is really of essence. And time is money. We've lost a lot because of him. He's also lost a lot. As a family, if you have a patient, the whole family, everything goes down.
The cost of healthcare continues to be a headache that has to be addressed. That's why we take a short break, and when we come back, we continue with this discussion on medical bills and the cost of healthcare in Kenya.